Session 2 Part 3. Now we will switch on fever with gastrointestinal involvement. The most common fever we come across is typhoid. It is especially in young adults we get that, and it occurs mostly at the end of summer and beginning of rainy season. We also get viral hepatitis in the same season. Let's see which drug come most often in cases of typhoid. Bryonia, rustox, pulsatilla, baptisia, phosphorus, lycopodium, sulfur, tuberculinum, carbovage. Now we'll see when and what stages of typhoid these drugs come. The most common drug we come across in treating typhoid are bryonia, rustox and pulsatilla. Don't forget baptisia. The characteristic of baptisia is the toxicity of typhoid, which generally commences after 6th and 7th day onwards. In baptisia it comes early. Maybe on the 4th or 5th day you get toxicity and you try to detect baptisia. Don't wait for the full-blown picture as we get in textbook. You may get toxicity, the patient may be with high fever, he may have coated tongue, abdomen bloated, and all such symptoms will be there, and at that stage it is better to give baptisia. Don't wait for Vidal test. Give these drugs in 1 m and 10 m potency. Now it may occur that after you give this drug, the typhoid, the fever has come down, but even then the spike of fever remains, maybe in the morning or in the evening. There, the group of drugs which you can think of: phosphorus, lycopodium and sulfur. It also occurs that, the fever has disappeared, but sometimes it may occur, a spike of fever may occur, the patient is not yet fully recovered. It's better to think of tuberculinum. Tuberculinum you may give in 1 m potency 1 dose and the picture will change. Sometimes it occurs that you have treated the case, tuberculinum you have given, or even the patient is alright with the earlier drug, but the lingering effects of typhoid, like loss of appetite or you may say weakness may persist. Think of the drugs like carbovage, China and Sorinum. Now, in the same season, as I told you earlier, we get cases of viral hepatitis. We'll see the group of drugs which cause viral hepatitis. Arsenicum album, phosphorus, pulsatilla and sulfur. Now, these are the common drugs which occur in the beginning of viral hepatitis. When jaundice appears, which happens in many cases, the fever disappears and we have to treat jaundice per se. We will think of the treatment of jaundice sometime later. Now, just as these typhoid and viral hepatitis is common, another common fever which we get especially in female is urinary tract infection. Now we'll try to find out the most commonly indicated drug in urinary tract infection. See the list. Cantharis, Merck-Sal, Merck-Cough, Pulsatilla, Sepia, Sarsaparilla and Thuja. Let's see the indications for this drug. As you know, Cantharis, of course, the most prominent symptom is intense burning before, during and after. If you could take Marsal, it's the intense pain which he gets while urinating. The pain is such that the patient doesn't feel like coming out of bathroom because he feels the act of urination is incomplete. Now what is the difference between Marsal and Markar? It is only the intensity. Markar is so intense that actually the tears come from the eyes. So that is how the difference between Markar and Marsal is only the degree of intensity of the symptom. Remember that. Now there is another group of drugs as I told you earlier. Pulsatilla, Sepia, Sarsaparilla. You know, Pulsatilla and Sepia, of course, the indications you know from our earlier talk. Sarsaparilla, the most prominent symptom in Sarsaparilla is the pain at the end of urination. At the end of urination, only few drops are there, and there the patient gets pain. That's Sarsaparilla. Where Thuja comes, sometimes you will find that, especially with the infection of E. coli, the urinary tract infection, either it is difficult to root out or it becomes quite recurrent. There it is advisable to give Thuja 1 ml and 10 potencies for quite some time. Now infection of the nervous system like meningitis and encephalitis need prompt diagnosis and hospitalization. But short of that, sometimes, especially in children, we get symptoms of nervous system like drowsiness, loquacity, irrelevant talk. The child may startle during sleep, he may have twitching, he may have convulsions. Now these are, especially in children, we get these symptoms with nervous system involvement. There is a group of drugs which we can think of commonly if that occurs. Now look at this list. Hyoscyamus, Stramonium, Veratrum viri, Sina and Teucrium, Aurum triphyllum, Nux vomica. Now Hyoscyamus, Stramonium, Veratrum viri, as you know, these are the salts related to or the drug related to belladonna, and you have to refer to Materia Medica, the symptoms which may commonly occur in this drug. Sina and Teucrium, you remember these two drugs, especially in children with worms concomitant. Aurum triphyllum is one of the drugs, very useful, which occurs sometimes. The symptoms of Aurum triphyllum, the child is drowsy, he just goes on picking at his nostril until it bleeds. He will also go on picking the lips, and these are the symptoms of Aurum triphyllum, along with the high fever, little toxicity, the child is drowsy, that is Aurum triphyllum. Nux vomica, don't forget that, with high sensitivity and gastrointestinal symptoms. Now, eruptive fever, that is measles and chickenpox, are not very common, but yes, sometimes we do get cases of measles and chickenpox. The most commonly indicated drugs in these conditions, look at the list. Pulsatilla, Rustox, Marsal, Lycopodium, Phosphorus, Sulfur, Zincum metallicum. Now, most of the time, the case is over with Pulsatilla, Rustox, Marsal. Quite often, especially with the children where this eruptive disorder like measles and chickenpox are common, they may develop bronchopneumonia. There, of course, we have to think of Lycopodium, Phosphorus or Sulfur. Remember one complication of these conditions, that is encephalitis. You may get it rarely, and one of the drugs to be considered at this stage is Zincum metallicum. What is the characteristic? Characteristic is patient is in toxic, stupor state, sort of semi-comatose, but he may get pitchings here and there, or most commonly the restless feet. Restless feet. You will get suddenly. So that is what gincum metallicum. Now we will come to a very common condition in our country, malaria. Now malaria may come in epidemic or pandemic form. Actually clinical research is required for cases of malaria because that is a very common condition, and it's a problem in our country, malaria, treatment of malaria. The most commonly indicated drugs are, see the list: arsenicum album, sulfur, lycopodium, natrum moon, Eupatorium perfoliatum, and sepia. We have found all these drugs useful in 1M and 10M potency. Now these are the common types of fever we come across. I would like to remind you on certain points by treating cases of fever. Number 1, teach a patient to keep a temperature record. This is helpful to find out time modality related to fever. Number 2, pulse rate and respiratory rate helpful in diagnosis and overall assessment. Details of symptoms. For example, if the patient is feeling cold, find out which part of the body he feels more cold. If the body ache is there, find out its intensity, which part of the body. All these details are very important while examining the cases of fever. Number 4, general condition of the patient. It means dullness, restlessness, irritability, and so on. Overall feeling of well-being is important. Suppose if the patient is having temperature 104 and it has not changed next day, but if the patient is feeling overall, he said, yes, I am feeling little better, that is a criteria for not to change the drug, that means the drug is acting. Number 5, inquire into physiological functions like appetite, thirst, defecation, etc. Number 6, physical examination including details like coating on the tongue, color of the coating, sensitivity to light, touch, etc. are important. Normally for diagnostic purpose these things may not be important, but they are important from homeopathic standpoint for drug differentiation. Number 7, if temperature exceeds 103 degree Fahrenheit, naturally the parents are worried. It is advisable to advise the sponging, which will reduce the fever to some extent. Number 8, clinical judgment is important. In certain cases, it is necessary to resort to antibiotic therapy. Refer the patient to an appropriate place. Remember, this is not necessary in most of the cases. As you practice more and more, you will find that resort to antibiotics become less and less, and you are able to treat more and more cases of fever. This is Dr. Apte from Association for Research in Homeopathy. Our next session, that is session 3, will try to present cases of fever from our practice. Thank you.